So when we talk about, when I say, well, there's a smorgasbord of options out there, I just want to run through a few of those and give people some familiarity with them, just so they understand these are really simple, straightforward things that can be taken care of pretty quickly. One is Botox, and Botox works by paralyzing muscle. That's why it works on wrinkles. Well, it turns out in those patients where the bladder's contracting a lot or too much, and they have a sense of urgency, frequency, they're getting up a lot at night, you can go in and put a little bit of Botox at the top of the bladder, paralyzes the top of the bladder calms down. That's done in the office. It doesn't require a trip to any operating room. Don't have to do it in a surgery center. You really don't need anesthesia. We use a little bit of lidocaine jelly, but patients can come in on their own. They don't need a driver. They can get in their car, go home, go to work. So it works quite well. It lasts for about a year, so there is an issue of it having to be repeated, but sometimes it lasts longer than that, and patients tend to be highly satisfied with it. Another one of these techniques is an agent called Bulkamid, and Bulkamid is a bulking agent that's placed into the urethra, into the opening of the bladder, right at the neck of the bladder. And it essentially bulks up that area. It increases the amount of pressure that would be required to open the urethra, so it really helps with preventing urine loss in those patients, typically patients that have what we call stress incontinence. So for them, when they cough or sneeze, the top of the bladder will be squeezed, and if the urethra is weak, it just splays open and they will leak urine. Bulkamid, by increasing the pressure that would be required, makes it so that when they laugh or sneeze or bear down, they stay dry. And I think that's, over time here, going to replace the sling. So you may have heard of patients having a sling, and that's certainly indicated for some patients. But there's a lot of patients where this is highly effective and it works quite well, and it's simpler and easier than the sling. It doesn't require any incisions. Recovery is immediate. In our offices, we have excellent physical therapists that just focus on pelvic floor, and those people can be quite helpful in this setting. For patients where simple things don't work, we've got we can put in a pacemaker, and the pacemaker can calm these nerves and can affect them in a way that overcomes any injury. This is also very simple. It's a two-step process. The first is that they come into the office. Again, they can drive home afterwards. It doesn't require any. I use a little bit of local, but otherwise no anesthesia, and we put in a temporary pacemaker. Takes about 20 minutes. Again, you're not going to the operating room in any way, and you trial this for a week. And this can be used for fecal incontinence, severe urge incontinence, people that are getting up 5-6 times a night. It can be, and who've failed some of these other things. We can use it in that setting. And the patients come back and they either say, this is the greatest thing since sliced bread, or in some situations it doesn't work. But it's really a minimal investment for those patients where this is a severe issue. In those patients where it's working, there's a second step to it, and that step does involve going to an outpatient surgery center, and we put in a permanent pacemaker. And it's about the generator for it is about the size of a quarter. So it's about this big. It goes under the skin. It's not something that interferes with going through TSA at the airport. It's not something that a patient can still have imaging and radiology, a CT or an MRI. Nobody notices that it's there. They're the only ones that would appreciate that it's there. And it's quite easy to use. And it's for those patients where this is a severe issue, it's life-changing. They're having trouble controlling their bowel movements. And for those patients, they are shuddering in. They can't go on a walk with their girlfriends on the trail. They can't travel anywhere. They avoid family events. So if I can help them, I feel good at the end of the day. And this particular technology can work quite well in those patients. So I just want to make sure I communicate to patients out there that have that issue that this is something I feel we can help them with, or we have a good chance of being able to help them with. And I'd really encourage them to come in and have us kick back our chairs and talk through it if it's a big issue for them.